and she's now attending them regularly. She joins in other activities and she's made friends for the first time in her life with other carers.
And I found that the care that I've received from my GP and the encouragement that I've received from everyone at the GP's surgery has helped me to keep going and to keep doing a busy job.
I'd like people to feel that this is something, well, a bit like the hospital, you know, this is something we would go on the streets for if we had to.
We wanted to break away from the denigration of the service, the criticisms of the service that seem to be flying around everywhere. And we wanted to build on the strengths of the service that's here now in Lewisham. And we talked to over 100 people, both users, clinicians and managers of the service, and we asked them for examples of the best community healthcare in Lewisham now. And we have come across the most wonderful stories of people doing, clinicians, neighbours, all sorts of people and organisations doing the most wonderful service for people of Lewisham community healthcare. And overall, we want to maintain and improve current service and to protect it from privatisation. That's the major aim of this process that we've started through the appreciative inquiry.
Appreciative inquiry is to appreciate the good. That is not to say that everything is hunky-dory, everything's perfect. There is also, there are examples of poor care. But unless we know what it is that is working well and that we want to fight for and defend, we're at risk of losing it. So I think we appreciate it, but we also realise there's an awful lot of work to be done. Save Lewisham Hospital campaign, you all know about it, you've all probably been involved in it in one way or the other. And it was many, many things, but one way of looking at it is one of the best examples of public and patient engagement you're ever going to see. Because this was the majority, the mass of people in Lewisham, patients, public, staff, people who worked right across from hospital to community to general practice, mental health, actually saying, we want a say, we want a powerful say in the kind of services we have in our community. It's easy to defend a hospital because it's there and you can see it, but community care is more nebulous. Most people probably wouldn't be able to list the services involved. So first of all, we need to define it, but we also need to set standards. We need to say, this is what is good, and this is what we want actually to generalise across the whole service. This is what we want to defend. This is the standard we want to set. And that is one of the best defences against it being put out to tender, because the private sector, who are winning some of these contracts, Virgin, Care UK, the first thing to do when they win a contract, they cut the staff, they cut the staff's terms and conditions, their numbers, their training, etc. And that leads to a reduction in quality. We need to define quality, and a lot of the quality, I think you'll hear it today, is about the staff having time to listen, the staff having time to care. We need to define those standards, otherwise they'll be taken, the whole service will be run down and taken from us.
So this is why I think we're doing this today, is to sort of think of new ways of engaging with people and getting people on our side.
I'm here to find out how we can make things better for patients.
When the hospital was threatened, suddenly lots of people came together and I didn't feel as though I was isolated.
Community, do you mean?
Community
do you mean
is community health, yeah.
Healthcare stuff?
Yes.
But our concern is that more and more services are going to get commissioned out, and it's going to be small pockets of work here, small pockets of work there, and it's going to become even more fragmented.
They're gradually cutting back and cutting back, and these are things that talk about looking after mental health. We need mental facilities for them, to stimulate them, to keep them going. The dental care, ideally, we'd like that to be like the GPs.
basically free.
If a resident requires information, they only need to go to one place rather than going a merry-go-round to get information.
The voluntary sector shouldn't be loaded with some stuff which should be statutory responsibilities. There's an imbalance, and I've been to meetings recently when it's, oh, well, the voluntary sector can pick that up. Can they?
This notion of a moratorium on all PFI debts, how it could be done, like the points you were raising, difficult, but I think it's like a principle.
Probably engaging young people.
Engaging young people.
Young people, because they are our future anyway.
This evening we're going to be speaking about mental and sexual health with young people. How do you feel about the changes to mental health within your school?
Well, it's had a fantastic impact on all the students. It's so engaging and exciting.
I'm absolutely sick to the back teeth of undertaking assessments and telling people they're not eligible. They don't meet the eligibility criteria. Where do they go? Who do they see?
My condition's been getting worse, and I'm really having trouble breathing.
Please don't worry. We've got your number. I've got it here on your records. I can see it on the screen.
If you're feeling that things are getting much worse, would you please phone 999 and get an ambulance?
I think it's probably best if I get a physio to come in to see you.
We need an integrated service because it makes better sense if you're maximising resources, if you want to make a, have a seamless approach.
The integration of services was the thing that was of primary importance, and people thought that it was vital for preventing people being in hospital for too long.
We need to have open data, and by data I don't just mean numbers, we mean information. That everybody has access to the various evidence so that they can evaluate it for themselves.
We believe there should be a moratorium on all PFI debts. We believe there should be joint action between Lewisham and Greenwich boroughs.
One of the things that really made a difference was that the patient was offered the ability and supported to make decisions for themselves and letting me have a say in the solution. And also that there needed to be investment in people and communities so that they can care for themselves, their families and friends.
And then something that came up time and time again was the importance of being listened to, listening, time spent with someone at the right time. So sometimes when you go to the GP and they only have 10 minutes, it feels like too little, but sometimes they'll give you a bit more, or sometimes that's just enough. But it's really important that it's at the right time.
The next category was sees the person and the social situation, not just the condition. So the comments here was, she looked at more than my symptoms. So looking at the bigger picture and seeing the whole person. And this came up quite a lot of times, that rather than looking at part of the person, they're looking at the environment they're in and everything else that surrounds their actual physical health.
And the final theme that came out of the 100 stories was what people value the most. The question we asked was, what would you be most afraid to lose? So people were worried that these things might go under the pressure of cuts, and underlying it really was a strong fear which came out in lots of different ways, that services would be privatised, fragmented, and therefore less effective for people.
We want to build a movement in Lewisham that cares about its community healthcare in the same way as it cares about its hospital. If there are threats to community healthcare, we hope that there may be people willing to come out on the streets to defend it if necessary.